Ladies, listen up. You ready? Are you tired all the time? Are you having weight gain, depression? Here's the key word: hot flashes or night sweats. No worries. Dr. Petersen is here from Holtorf Medical Group. Of course, we're talking about menopause and perimenopause. What's the difference between the two?
Well, perimenopause is when your hormones start to go down, you're starting to have symptoms, but you're still having periods.
See, that's such a jip. Why do we still have to have it if we're going through all of that?
Right. Well, it's sort of nice that way, because if it happens all at once, your symptoms are way worse.
So there's
a thing called surgical menopause. If you go have a hysterectomy and they take out your ovaries, you went through menopause in one day and you have all of those symptoms right at once. Some women go through perimenopause and menopause and have very few symptoms.
What's the age that starts?
Well, it can start as early as your mid-30s, that your hormone levels start to decline. And as they decline, you begin to have symptoms. And you sort of highlighted hot flashes. And that's what I think every woman is thinking: oh, I'm not in menopause yet because I don't have hot flashes.
Because you don't have them, yeah.
Right? By definition, menopause is when you haven't had a period for a year. But as your hormones are going down, you start to have irregular periods. And so really the first sign is not that you're having hot flashes. The first sign that you're going through perimenopause is that your periods are heavier, or they're more crampy, or you're more moody, the PMS is worse, you start to gain weight, your sense of well-being is lower, maybe depression, more poor sleep, you're not as sharp mentally.
Wow.
But no hot flashes yet. And you just think, what's going on? Maybe my kids are a lot of stress.
Yeah.
But it's perimenopause. And as those hormones go down, it's not good for your body.
So what do you have to do? You have to balance out the hormones? Or do you have to add more hormones?
Well, balance is important, and the right amount is important. So generally, your progesterone starts to go down more than your estrogen starts to go down, which is why the mood changes in the PMS and the decreased cognitive function, but no hot flashes yet. And you're still having periods because you're still making the estrogen, but the progesterone's lower and things aren't quite right. So balancing them is important, but as the levels get low enough, now your tissue doesn't know to regenerate and to stay healthy. And that's when we start to age physiologically. You look at somebody like one 50-year-old looks young and one 50-year-old looks old, and the difference is what's the level of their hormones.
So people, if you're having any of these symptoms, you actually need to go have yourself tested, right, to see where your hormones are.
Well, if you want to have them balanced and raised to the optimal levels. And there's a huge difference between normal and optimal, and that's part of the problem, is people will go in and say, I think something's wrong, and the doctor most of the time will say, well, that's normal. Well, it is normal, but it doesn't feel good, and it's treatable. Okay, so what
does that test involve? What do you have to do?
Well, there's actually a number of ways that you can test people's hormones. You can use there's a blood test, there's a saliva test, there's a urine test. I tend to do a blood test because it's covered by people's insurance.
Okay.
But they're all available, they're all good.
And what if you're not sleeping well? Is that all part of it too?
Yeah. Yeah,
bad, like dry skin, dry hair?
And vaginal dryness, decreased libido, hair falling out, your eyebrows becoming thin.
You know, I keep thinking, I'm like, wow, we went through all the birth. We went through all that, ladies. And now we got to go through this, too. I want to ask God, what were you thinking about this one? Okay, so when people come in, I want you to explain a little bit what you specialize in, because you're not just a normal, regular, general doctor.
Right.
You're not normal. Did you hear that? That's not what I meant.
Oftentimes, because doctors just simply say, it is normal for you to do this, we ignore it. I don't think that that's the best solution for people. I think the best solution is to say what's optimal, not what's normal.
Okay.
And I would say that's probably the difference between me and the way I used to practice, because I haven't always practiced like this, but over time I sort of realized, wait a minute, there's a lot of people I'm not helping that I could be helping. There's a lot of fear surrounding this from physicians because of a study done back in 2003 that said that hormone replacement therapy wasn't a good idea. But the study was a study on Premarin and Prempro, which are equine estrogens. That means estrogen from horses.
Yes.
So after the study was finished and we said, oh, look, this isn't such a great idea, it's causing an increased risk, what we didn't ever do was say, horse estrogens cause an increased risk. And so since that time, we've been a little bit afraid of treating people with hormones because we didn't understand the study.
Right.
So I think the difference, what I do is I simply say, oh, let's look at the science, let's look at the studies that are on human estrogens, human progesterone, human testosterone, bioidentical hormones, and let's optimize those things.
Not a cure, but there's help, right?
Yeah, it's not the fountain of, it's not eternal life, but it is certainly going to help you stay more youthful.
Oh, I love that. See, that's a happy ending to this story. Holtorf Medical Group is the place that we're talking about. This is Dr. Petersen. There's all their information right there on the screen. And if you want to know what we were talking about in this segment, just go on over to our webpage at goodforutah.com. You can click on Good Things Utah and actually rewatch this if you want to maybe take some notes or just give them a call. Just go in and give them a call if you're feeling any of this stuff or any things like that. And Glenn, I know you have nothing to add to this particular subject.
Nothing to add, I'm afraid. But very good information, that's for sure.
That's true.
Coming up next, we're going to make some